Hello, people from the internet. We are here with the famous Dr. Palmira from Avanti Derma. She's actively helping a lot of patients with their non-surgical girth enhancement. And right now we're going to hear a few words, and now we're going to hear and now we're having an interview with her, telling us all about the matters of girth enhancement, non-surgical, regarding PMMA, ELANS, and all any other questions that you have. You can leave it at the comments, and we're very happy to have here with us Dr. Palmira. Hi, Dr. Palmira. How are
Hello.
you?
Very good, thank you.
How long have you been working here at Avanti Derma and with Dr. Casavantes?
Well, with Dr. Casavantes, I have been working for almost 20 years. Here in Avanti, around 10 years.
Wow.
But
Yes. You have treated a lot of male patients along the way.
yeah, probably the 90% of the patients are male.
Yes. And how do they feel when they come here? Usually.
Well, at the beginning, they were like a little like embarrassed because I am a woman, but with the pass of the years, they are feeling very, very comfortable with me, with my job. Then it's very, very easy for me to work with males.
No, what do they say afterwards? What are the words that you have
Very
heard?
happy. They feel very happy because we try to give to the patient a very professional environment, and we try to be very professional with the patient. Then the patient feels calm and very happy.
Usually, when a male comes here to the clinic with you and they want to perform the non-surgical girth enhancement, how long does it take? How long does it take for everything? Just they take their clothes out, they put them the medical, all the
Okay.
protocol. How long does that take? during the
Well,
day?
probably typically it takes around 1.5 hours. All depends if the patient when it's the first time. Always the patient are very nervous. Then we need to be very do the procedure very slow to and but around 1.5 hours is the average of the each procedure.
And really quick, before they come here with you, what's the usual protocol people have here at your clinic in as far as airplane coming here with you here at the city of Tijuana and the hotel? Can you just explain to me a little, just very short words that they have a shuttle and they have a hotel here
Sure.
really close and they come here walking?
Yes, well, Ian, my assistant, is take care of all that agreement with the patients. He explained to the patient what to do, how to take the shuttle, how to come to the clinic, and they do all the arrangement for the patient. It's very, very easy and very safe.
Yeah, basically they pick them up at San Diego airport.
This is San Diego.
And then they bring them all here to Tijuana. They cross the border in the shuttle, and they stay here at the hotel next to the clinic, which is just 1 minute away walking. You never
Yes.
leave the building.
No, exactly. And we always recommend to stay at least one night because we need to follow up the patient the next day. Then it's very important. Mhm.
The next day, what happens? They have to come here to the clinic for
Yes,
what?
to see that everything is okay, no bleeding, how is the swollen, and the patient needs to be very clear how to do a good aftercare.
So basically, first just the shuttle and hotel. Then they come here with you the next day. And this lasts for an hour and a half. Then the next day, they have to come back.
For one or two follow-ups, and then can go.
And then they can come back. How many follow-ups? So usually just one day?
The next day can be 2, 3, all depends. If the patient is very swollen or bleed a lot, my assistant can see it 2, 3 times. All depends of each patient.
Okay. Yeah, and after that, they can go home.
They can go home.
Okay, very good. So I have a little bit of questions because a lot of people from the internet, from followers, from YouTube, are very concerned or very enthusiastic about more volume. to their penis. So, Dr. Morales, could you briefly explain what the non-surgical penile enhancement procedure involves?
The girth enhancement is the application of soft fillers in all around the penis, and of course avoid the back of the penis or the urethra area. But it's just that the application of soft fillers, permanent or temporary fillers. Mm-hmm.
And do all patients receive the same amount of filler volume?
And no, because of course all the patients are different. They don't have the same size of the penis. They don't have the same elasticity of the tissues. Then it's very important that patients know that every patient is different and they receive a different amount. Of course, we have an average, but all the patients are different. Mm-hmm.
And if I want more or a lot more of the product you offer, can you apply it?
We can apply. Of course, we need to wait at least between one session to the other. We need to wait at least 6 weeks. But sometimes the patient just want more and more and more. And they don't care if the aesthetic, but for me, I'm a doctor, then for me it's very important the safety of the patient. Then sometimes the patient doesn't understand that. And if the patient have enough room for more, of course we can add more and a little more and a little more. But if it's too tight, I need to stop. Mm-hmm.
Is there a limit to the amount of volume that can be added? In other words, can I make it grow as much as I want?
Well, depends. For example, in one session, you can have a half an inch of grow, or 3/4 of inch, or sometimes until 1 inch. But all depend of the aftercare of the patient, because if the patient follow our indications, they have a very, very good results. But if they don't do a good aftercare, they won't see a good result. Mm-hmm.
Okay. So I need more than one session to. Why is that?
Well, we recommend 2 full sessions. Full session is around 20 cc's in each one, but sometimes with one is enough. The patient is happy with one, and also recommend some touch-ups just for little details. But all depends of the patient. If the patient with one session is happy, it's enough. But sometimes the patient wants more and more, and they sometimes want 3, 4 full sessions, but sometimes it's not possible.
What percentage of volume or what results can I expect after each session?
Of the product?
Yes, after each session, if I put out, let's say, the 20 cc's, or how much volume do I get again?
Okay. In the first session is around half an inch. You will see a half an inch of grow, 3/4 or sometimes 1 inch. All depends of the patient, all depends of the tissue and the aftercare. But it's the average is 3/4 of inch. Mm-hmm.
If I need follow-up sessions, how many will I need and how long should I wait between sessions?
6 weeks. We recommend at least 6 weeks. Very important. If the patient can wait a little more, it will be great. But something very, very important is the aftercare, because we can tell when the patient doesn't do a good aftercare. We can tell immediately, because we can see a lot of imperfections, lumps. Then that is a very, very, I think that the 50% of optimal result or success.
What is the difference between the 3 products you offer and which one is the most popular?
We have temporary fillers, which is hyaluronic acid. We have the semi-permanent filler, which is Elance, very popular, and the permanent filler, which is Linea Safe. For me, is my favorite because I have seen a great result with that filler.
That's the PMMA.
That's the PMMA, exactly. Mm-hmm.
What would be your message to a patient who knows nothing about the procedure or the fillers, but is very interested in undergoing it?
I recommend to the patient, every patient do their research. Very, very important. They research about the product, the filler, and also the doctors. It's very important. Also, I recommend to ask another patients the experience and be very, very sure about the procedure because if you are using a permanent filler, it's like there's no way back. Then it's very important the patient be very sure about the procedure and the product and the doctor. Mm-hmm.
And in a few words, how would you describe the experience here in Avanti Derma?
Well, we try to be very respectful with each patient. We try to give you very calm environment, and the procedure is very easy. Of course, when it's the first time, the patient is very nervous, but we try to be the most easy that we can. Then it's, I think, a very good experience.
Where can we find Avanti Derma here at Planet Earth? Where can we find it?
We are located in Mexico, in Tijuana, close to the border, probably 15-20 minutes to San Diego, and in a very safe area, very nice area, and in a very professional clinic. And
why would you recommend Avanti Derma compared to the other doctors or other clinics that are around the world? What are the advantages of coming here to Avanti Derma?
We have the experience, probably. Dr. C, he started doing this, then he has more than 20 years doing this procedure. I learned from him, then I recommend here for the experience and the good care that we have for each patient. And our technique is very different. And the aftercare of each patient probably is, that's why.
And of course, the price too.
And the price, because in US is very expensive, of course, and you don't know what they are using or what technique they are doing, then yeah, that's the price.
And just to close up, would you mention about the aftercare? What's a good aftercare look like for a patient that has undergone growth enhancement?
A good aftercare. We always recommend to be very clean with that area because the entry point needs to be very clean and dry. Then also we recommend the massage the area. We recommend keep the area extended and a lot of steps, very important steps, but it's that very, very important to follow step by step all the indications of the aftercare. Mm-hmm.
And also, a lot of patients come here because they want to be with their partners. And how long can they have sex after they have done the procedure?
That is very important because they want to do it immediately after 3-5 days, and we recommend to wait at least 6 weeks because they can experiment an inflammatory reaction, or the entry points can be open and contaminated. Then we recommend at least 6 weeks. Mm-hmm.
What about there's a lot of people that are using sex toys to grow hangers?
Yes.
What's the recommendation before the procedure? Should they use them? No. And afterwards, after the procedure?
Yeah, actually, before come, we also recommend consultation with us because we can recommend what to do before the procedure. We recommend a lot the stretcher, pumping the area if the patient want to do it, but we do like a little things, or we recommend some things to do the patient before come for better results.
And after the procedure?
Yes, after the procedure, they have to use some device that we recommend.
Like, there's a lot of people that want to do more volume under the shaft. What do you have an opinion about it? You as a doctor, how do you view more
Under the
volume
shaft?
under the shaft?
In the back area, we don't recommend. We know that some doctors work that area, but it's not safe because they have the urethra there, and we don't want to touch that area. We don't want to press that area. Then we work all around, but avoiding the back of the shaft, where is the urethra.
Okay. Is there a big difference? If they
No, because I work with a lot of product, then I give a more cylindrical shape, and they don't notice if they don't have anything in the back.
What are a few opinions that former patients have told you about how their sex life improved?
A lot, with their partners. They are very happy. Sometimes the partners they don't notice, but the patient feels more confident, feels much better, and they are very happy when they come back for the second session. They are very, very happy.
I think that having a female perspective helps them a lot. What with your female and doctor's perspective, what's a good recommendation you would give patients to have aesthetic, visually pleasing, beautiful penis for a man? What's a recommendation that you would suggest?
For aesthetic, something
Yes,
aesthetic.
that visually looks very good.
Okay, so, I recommend to use, for example, sometimes the patient just want bigger and bigger, and if the patient allow me to do my opinion of how to do it, I recommend to do more little by little, not too much at the same at the first session. Or if we are using a permanent filler, use the 10% and not a lot of 30%. Then, and of course, all depends the shape of the penis and the size of the penis. Depends a lot.
And what about for their partner's pleasure? How much girth would you recommend? Because a lot of patients also regret having a lot of volume because now their partners don't want to have sex anymore because it hurts.
Okay.
So what's a good recommendation for pleasure?
For pleasure, probably 1.5 inch or 1 inch is perfect, but sometimes they want 2 inches and doesn't look good, and patients refers that they have problems with their partners. Then we recommend 1 or 1.5 inch is perfect for a very nice look.
Okay. Because a lot of people that want to do under the shaft, they just want to do it because they feel that they're going to give more pleasure to their partner because on that lower area.
No, actually, some patients ask me to. They have their own ideas, for example, and they told me, I want a little more. I want this shape. I cannot change the shape of the penis, but if the patient wants a little more at the neck or in the center of the shaft, I can do that because some patients want like a different shape for pleasure to their partners. But respect to the size with 1 and 1.5 inches, perfect.
Okay. And What can you talk about? Just the three fillers that here at Avanti Derma offer?
We are using the temporary filler hyaluronic acid. We use Voluma. We use Volux. We use also the semi-permanent filler Elance. Radius, we can use Radius, but Elance is more popular in the patients. And Linea Safe, which is a permanent filler and is PMMA. This product stimulates your own collagen, your own elastin, and it's a very good product because it gives you a very natural and firm penis.
And for guys that want to have that they don't know much about this procedure, but they want to have a bigger penis, but they're not very sure. But also they don't want to waste a lot of money and the results go away in 6 months. What would you recommend for them to be a safe route for try it out,
Sure.
also enjoy it for a long time?
If the patient is young, around 20, 25, 28, we recommend to start with semi-permanent, probably the Elance. And he can try with that. The effect lasts around 1 or 2 years. Then if they like the results, they can switch with a permanent filler or continue with Elance. In the beginning, like 10 years ago, we have the Elance large. Then that kind of Elance lasts around 3-4 years, sometimes a little more. We have patients with that product and still have some. Then we recommend the Elance medium or small, which is lasts around probably until 2.5 or 3 years.
The medium one?
The medium
and
one.
the small one?
1.5 year. All depends of the patient. If it's young, it's a little more.
Okay.
All depends.
And why is that? Can you just describe what happens? It dissolves. What's the difference between HA and the lens?
HA and Elance. Okay, HA, the body absorb it a lot, and the Elance is stimulate your own collagen or your own elastin. Then lasts a little more because you are going to create a little more collagen in your penis. That's why it's going to stay more. And the permanent, they work just creating a lot of new tissue. That's why it's permanent. But the Elance work stimulating a little more collagen, elastin all around the product.
And thank you very much, Dr. Palmira. It's been a pleasure having you here with us. Hope to see you soon, and we're going to pay a lot of attention for all the people on the internet that have any more questions in the next few weeks.
Okay.